Last week, the World Professional Association for Transgender Health, WPATH, released its Standards of Care version 8. You may remember that earlier this month, we covered the story that WPATH was expected to lower its age recommendation for children to receive gender surgeries. Instead, WPATH removed age guidelines altogether with no explanation as to why. Now, this is important because counselors, hospitals, children's court judges, and other officials tend to march in lockstep with the advice of this rather radical transgender organization. So what does the removal of the guidelines mean? Joining me now to discuss this is Dr. Jennifer Bauwens, Director of the Center for Family Studies here at Family Research Council. Dr. Bauwens has extensive clinical and research experience working with survivors of trauma and abuse, and has also taught on psychological trauma and research methods in several graduate programs. Dr. Bauwens, good to see you today.
Good to be with you, Joseph.
So what was your first reaction when you saw these new guidelines that did not have any minimum age requirements?
Right. Well, in some ways, you could take this as, okay, maybe they're responding to a lot of the pushback that they've seen definitely on the national scene here in the U.S., where we're watching Boston Hospital and other organizations where it's come out that very young people have been subject to these transgender procedures. So, you could see that perhaps there could be a response to sort of say, okay, we're not going to address the age thing at all. But on the other hand, it's also very disconcerting that there is no age, because what does that mean in terms of having guidelines that actually give no age for how you engage in cross-sex hormones or transgender surgeries? That's very disturbing.
Does this seem more likely to be turning a blind eye if 5-year-olds are transitioned, or simply not encouraging 16, 17-year-olds to be transitioned?
Right. I mean, and we know that there have been clinics in the U.S. that have seen 2-year-olds, and have some of these folks who are aligned with the WPATH guidelines have said, what is age? It's just a number. So this is disconcerting because obviously if gender is considered a social construct that supersedes biological sex, then what's next? Is age also just considered, as this person said, just a number that doesn't really matter, and you can have these procedures done whenever you first exhibit any sign, and by the way, stereotypical sign of identifying with the opposite biological sex.
Dr. Bauwens, Rachel Levine is the Assistant Secretary at Department of Health and Human Services, also reacted to this, had this to say over the weekend about the new guidelines. Let's play clip 5.
It is critically important that medical decisions and the public pronouncements about them are based on science and human compassion rather than slander and stigmatization. The mental health of a generation of young trans Americans depends on that. It is wrong to politicize medical care.
Dr. Bauwens Dr. Levine there said that it's important that we act on the basis of science and compassion. But isn't the real challenge here that both sides believe the other side has politicized the science?
Yes, both sides do believe that. And I would actually agree with Dr. Levine's comments, because we do need to base things based on science. But let's just step back for a moment and look at how the WPATH guidelines were actually conceptualized. So when you talk about evidence-based science, it's supposed to be a science that is based on the best available evidence, right? So my question to WPATH would be, well, what do you do with all of the evidence that shows that that there are harms to one's physiology. That what about the cardiac issues that arise, or diabetes, or bone issues? And then what do you do with this other group of people who have clearly, these procedures haven't worked and they've detransitioned? Doesn't that merit investigation? And then, of course, what do you do with all of the reports that when organizations like American Academy for Pediatrics, when their membership is calling for a review of the science, and instead you suppress their ability to make comments, or universities that are suppressing studies that are contrary to the quote-unquote best available evidence that WPATH claims that they're about. So just to give you context there, but in the reality of how these are formulated, it's actually by vote. So just to demystify the scientific process, they're looking at this science that aligns with their viewpoint, and it doesn't take much to unpack that. And
Dr. Bauwens, in just a few seconds here, I want to quickly ask, do you have reason to believe that those arguments are even being considered by WPATH, the negative consequences of these transitions?
It certainly doesn't seem like it, Joseph. It seems like what's happening is more of a political dance rather than one that's truly after the well-being of children. Because if you were about the science, you would invite those to the table who have contrary opinions, and you would start conducting research that actually addresses the concerns that so many have stated.
Dr. Jennifer Bauwens, thanks for your time.
Thank you.